So this is a meta-analysis we did from a systematic review. So what we're looking at is the sex difference, whether there is any utilization of the endovascular treatment between the males and females, and whether the sex difference would impact on the outcome after the endovascular treatment. So this study is much more looking at this, first of all, the equity, which the two genders receive the reperfusion treatment, which is very important for the ischemic stroke patients, especially for those with the large vessels occlusion. And secondly, we just want to know, looking at much more specific on the outcomes, and say if there is any explanation between the outcomes by the sex. From our systematic review, we found actually there is no sex difference between the two groups, female and male, for receiving the endovascular treatment after ischemic stroke. However, we found that in the subgroup analysis, we found the females in European countries, they have received a more higher proportion of endovascular treatment after ischemic stroke compared to male. We thought it probably because there are a lot of trials have been done in European, especially, and also other kind of observational studies, such as the registries and hospital-based studies, and also as we know, women have a longer life expectancy than male. So as stroke as a kind of aging disease, so those who have a higher, so women probably will have a higher proportion to have stroke. And also because in European countries, a lot of hospitals, they have built up the settings for the endovascular treatment. So that means those who have stroke onset, once they were admitted into hospital, and if they are eligible for the endovascular treatment, they will receive it. But when we're looking at the outcomes by sex difference in endovascular treatment, there is also no significant difference between the two groups. And also we found that most of the studies, they only looking at the functional outcome, but not looking at the health quality of life, which we saw actually in previous studies, there were sex differences in the quality of life. So we hope in the future there will be more studies looking at the sex difference in the health quality of life.